and welcome everybody to this 1-hour webinar on advanced interpretation of the WISC-V. The fact that we're focusing on advanced interpretation presumes that you are bringing with you the foundational knowledge of the WISC-V. Therefore, by the end of our time together today, I would like to be able to describe the cognitive processes that are represented by the WISC-V index scores. I've included in your handout a number of slides that describe those cognitive processes. For this presentation, I will spend very little time focusing on those cognitive processes. I want to address them because I think that they will provide the foundation for the interpretation at which we'll look toward the end of our time together. So I won't spend too much time on the cognitive processes, but I do want to describe the theoretical link between cognitive processes and specific academic skills, and then I want to use some sample data to talk about how we as clinicians will use performance on the WISC-V to generate hypotheses about processing deficits, cognitive processing deficits, but really to start thinking about what those cognitive processing deficits or an individual's cognitive profile would tell us or lead us to hypothesize about academic achievement. You should have received 2 handouts. Most of the slides I'm going to show you here today are included in one handout, and then I also included a sample report that I generated using our scoring software. That sample report provides the data that I'll use toward the end of our webinar today. Let me just take a brief look at the conceptual structure of the WISC-V, and we hope that you've attended some of our introductory webinars on the WISC-V, in which case you'll be familiar with the conceptual structure. The conceptual structure I have pictured here, and I'd like to draw your attention to the basic composite scores beginning with the secondary factor, the second order factor, the full scale IQ, which is derived from 5 primary index scales or 7 of the subtests that make up the primary index scales. In addition to the primary index scales, there are a number of ancillary index scales and a number of complementary index scales. I'll say a few words about each of these index scales. The other thing I want to say based on what you're seeing here is that, as you know, based on your introductory knowledge, the WISC-V includes a number of what we're calling primary subtests. The primary subtests are these 10 subtests that make up the primary index scales. In addition to those 10 primary subtests, there are 10 secondary subtests that don't contribute to the primary index scales, but that you can use if one of those primary index subtests was invalidated for some reason. So 10 primary subtests, 6 secondary subtests, and 5 complementary subtests, naming speed, 2 that load on naming speed, 3 that load on symbol translation. So we'll talk a little bit more about primary and secondary subtests. What I'd like to do now is take a look at the index scores and then think about the cognitive processes that contribute to effective performance of those tasks. So I want to start with the full scale IQ, and as we all know, the full scale IQ is the best predictor of important life outcomes. When we're thinking about the age range of the WISC-V, you're thinking starting at age 6 and going through 16. So one of the important life outcomes certainly is academic performance. And the full-scale IQ is a really good predictor of academic performance. It's the most reliable score. It's derived from 7 of the primary subtests. It's the most representative of global intellectual functioning, psychometric G, if you will, and it's often the first score that you consider when you're interpreting a child's performance on the WISC-V. Next, you would look at the primary index scores, and the primary index scores, along with the full-scale IQ, are the ones that we recommend for comprehensive evaluation of intellectual ability. Those 5 primary index scales are verbal comprehension, Visual-Spatial, Fluid Reasoning, Working Memory, and Processing Speed, and each is composed of 2 subtests. So let me say just a few things about the cognitive processes that contribute to successful performance on these primary index scales, beginning with the Verbal Comprehension Index. Certainly, as we all know from previous editions of the WISC or other Wechsler measures, the VCI is a measure of crystallized intelligence. When you think about all of the cognitive processes that are involved when we're asking children to tell us the meaning of words or to tell us how 2 things are alike, you're thinking about the child's ability to apply and access acquired word knowledge. So word knowledge acquisition is important in performing these tasks. Certainly being able to retrieve information from long-term storage, being able to think and reason and solve verbal problems. And then when you think about the output demand of these tasks, you're thinking about the verbal expression or the communication of knowledge. In contrast, when you think about the Visual-Spatial Index, you're thinking about the input demand of this task as being visual compared to the verbal comprehension where the input demand is verbal. So this one assesses ability to evaluate visual details and to understand visual-spatial relationships. So some of the cognitive processes that are necessary to perform these tasks, block design and visual puzzles are the 2 subtests, would be visual-spatial reasoning, certainly the integration and the synthesis of part and whole relationships. Think about block design and visual puzzles. You also have to pay attention to the visual details, and especially for block design, there is that visual motor integration demand, not as much on the visual puzzles where the response often is pointing and where children can even respond by verbalizing, giving you the number of their choice. The Fluid Reasoning Index is new. Well, the Visual-Spatial Index as well as the Fluid Reasoning Index are new to the WISC-V. They were both based on the Perceptual Reasoning Index from the WISC-IV. The FRI measures the child's ability to detect first underlying conceptual relationships among objects and then to use reasoning to apply that conceptual relationship. So the Fluid Reasoning Index is made up of matrix reasoning as well as figure weights, and both of those tasks, the stimuli are visual. So in order to perform this task, you're thinking about the child being able to reason, to use inductive and quantitative reasoning. Certainly broad visual intelligence affects performance on the Fluid Reasoning Index as well. Simultaneous processing as well as abstract thinking. When you look at working memory on WISC-V, as you know, is a little different than the working memory index on WISC-IV. And the reason is that working memory on WISC-V now has 2 different modalities. When you think about Baddeley and Hitch's multi-component model of working memory, where verbal information is processed through the phonological loop and visual information is processed or stored, not processed, through the visual-spatial sketchpad. So the working memory index on WISC-V is made up of both digit span, which has the verbal as the input modality, as well as picture span, which captures the visual as the input modality. But regardless of the modality, working memory tasks require examinees to focus attention in order to register the information that they're seeing or hearing, and then to use both auditory and visual discrimination depending on the input of the task. Certainly concentration is important as well. So attention, concentration, being able to focus and sustain attention is important when you're thinking about registration or encoding of the information. And then once you've registered or encoded the information, you need to be able to maintain or hold the information in short-term memory. And depending on your capacity or your memory span, you may need to actually do something actively such as rehearsing, for example, in order to maintain the information in short-term memory. And depending on the demand of the task, for example, the backward condition on digit span or the sequencing condition, you may need to resequence the information depending on the demand of the task. So certainly you want to think about the task and what cognitive abilities are necessary in order to perform the task effectively. And then processing speed is the last of the 5 primary indices. Certainly you're thinking about speed and accuracy of information processing, and the information on both of the tasks, coding and symbol search, is presented visually. So you're thinking about processing that visual information in order to make a decision and then to implement your decision. So you're thinking about certainly short-term visual memory as being important, visual discrimination, visual scanning and sequencing, attention, concentration. The output demand of the task requires visual motor coordination, and certainly rate of test taking is important. This is a speed task. I think when you think about the visual-spatial demands and the fluid reasoning demands, let me just say a few words about visual-spatial compared to fluid reasoning. Visual-spatial tasks require us to register information that's presented visually and then to see relationships between the parts. Fluid reasoning, on the other hand, is a higher order conceptualization and reasoning task. And for most complex problem solving, even if the stimuli are presented visually, we invoke or we integrate that verbal component. So fluid reasoning tasks, often for most effective problem solving, require the examinee to integrate what he or she sees with what he or she is thinking verbally. So on matrix reasoning, for example, pretty much when we tell the child that you can solve the problem by going across or going down, what we're doing effectively is sharing with the examinee a problem-solving strategy that we know is going to be useful, especially as the items increase in complexity. So fluid reasoning tasks are most effectively solved by integrating the visual and the verbal problem-solving modalities, which is what we all do when we're engaging in complex problem-solving. But if you think about lower-order tasks, like reading, for example, the alphabetic principle or phonics really is a good example of something in the child's functional environment where they're integrating the orthographic and the phonological in order to solve the problem. In addition to the primary index scales, there are 5 ancillary index scales, and these index scales are derived from combinations of all primary subtests and in some cases of combinations of primary and secondary subtests. So for example, if you look here at the Quantitative Reasoning Index, figure weights is a primary subtest, arithmetic is a secondary subtest. Auditory working memory, digit span is a primary subtest, and then letter number sequencing is a secondary subtest. These indices, and I'll talk about each one in turn, these ancillary indices provide additional information about a child's cognitive abilities. So when you start thinking about a pattern, maybe relative strengths and weaknesses or intra-individual strengths and weaknesses, the ancillary index scales hopefully will provide information that will allow you to start thinking about how that pattern might impact performance in the child's functional environment. So let me say a few words about quantitative reasoning. So quantitative reasoning, and this picture here I got from one of the back pages in the record form. Quantitative reasoning, as I mentioned, is composed of 2 subtests, figure weights and arithmetic. One of the things I want to point out about quantitative reasoning is certainly that this is important. These data are important, especially if you're working with a child who is struggling with math in the classroom and of whom we believe that that child might have a specific learning disability in the area of math. But when you think about the 2 tasks, sometimes it's instructive to look at what the actual subtest measures. So arithmetic certainly requires computational ability and quantitative knowledge, but it's the one subtest on WISC-V that loads on 3 indices. First, on fluid reasoning, as opposed to working memory. If you remember from the WISC-IV, it loaded on working memory, always had a significant fluid reasoning component, but now with the addition of that fluid reasoning index, arithmetic has its primary loading on fluid reasoning, although really the coefficient is very similar for fluid reasoning and working memory. But certainly it loads on fluid reasoning, has a significant working memory demand, and we also recognize the significant verbal comprehension demand. Figure weights, in contrast, requires math in a more limited, abstract manner. Figure weights also has a significant working memory demand, except it's not as great. It's a little reduced compared to arithmetic, because on arithmetic, all of the information is presented verbally, so the child has to hold in mind all of the information that he or she hears, whereas on figure weights, there is a visual stimuli that the examinee can access in order to refresh his or her memory. But on figure weights, this is the hallmark of fluid reasoning tasks. You are establishing or identifying underlying conceptual relationships, and on figure weights, you'll use the quantitative concept of equality to establish that underlying conceptual relationship. Then you'll apply specific math concepts such as matching, addition, and or multiplication to identify the correct response. So just to give you an example of what that looks like, in fact, here would be an item from figure weights, and essentially I want you to make these 2 scales equal. So you're looking at that concept of equality, and essentially you may now, generate an algebraic equation in order to solve the problem. So you may say, for example, 2 pink diamonds equal 5 yellow circles. Therefore, 4 pink diamonds would equal 10 yellow circles. So again, you're trying to use that concept of equality and then use specific mathematics concepts in order to solve the problem. And certainly if you think about the solving of the algebraic equation, that involves working memory for sure. So if you think about the quantitative reasoning index, certainly you're thinking about performing mental operations. That's certainly important, being able to understand and apply quantitative relationships, but certainly working memory, verbal problem solving, as well as that abstract conceptual reasoning. Auditory working memory is very similar to the working memory index on WISC-IV. As I mentioned when I showed you the working memory index, working memory is now based on a multi-component model that focuses on the 2-domain specific storage system, Baddeley's phonological loop and Visual-Spatial sketchpad. The auditory working memory is made up of digit span and letter number sequencing and is a pure measure of auditory working memory. Still, if you think about the cognitive abilities that are required to perform the task, you're still thinking about capacity or span, certainly being able to register and hold in short-term memory the information that you're hearing, attention and concentration is important, and then certainly the auditory memory. Numerical ability is important as well because we are asking children to sequence on digit span sequencing as well as on letter number sequencing. And the Nonverbal Index is a really robust index on WISC-V consisting of 6 subtests: block design, matrix reasoning, coding, figure weights, visual puzzles, and picture span. And we hope you'll find this useful when you're working with examinees with obvious verbal difficulties, whether English language learners or children with receptive or expressive language disabilities, or maybe autism spectrum disorder with language impairment. The General Ability Index is retained from the WISC-IV, and you should be familiar with this one. It's going to give you an estimate of general intellectual ability that is less reliant on working memory and processing speed than the full-scale IQ. And then cognitive proficiency is really digit span, coding, the 2 working memory subtests, and the 2 processing speed subtests. And the CPI is best interpreted in conjunction with the general ability index because it will give you information about the efficiency with which the child processes information in the service of learning. So children with low scores on the cognitive proficiency index and high scores on GAI often do really well in the classroom, except they work quite slowly. So these may be children who are processing information slowly. They have to take work home while everybody else has already completed the work in the classroom. So cognitive proficiency is really important because it's highly correlated with G, psychometric G. And then finally, when you look at the complementary index scales, these are not part of the assessment of intelligence per se, but they were designed to enhance the assessment of children with learning difficulties. And if you look at the 2, so we say there are 21 subtests on the WISC-V, there are 10 primary subtests, 6 secondary subtests, and 5 complementary subtests. And the 5 complementary subtests are naming speed literacy, naming speed quantity, and then your 3 symbol translation subtests. So let me say a few words about naming speed and symbol translation. And the combination of naming speed and symbol translation will provide us with a storage and retrieval index. So naming speed really is very similar conceptually to your rapid automatic naming tasks. So essentially what we want the child to do is to see a visual stimulus and to quickly retrieve from long-term memory the phonological code for that visual stimulus. And that's really what's involved when we're thinking about reading fluently, reading effortlessly, reading at the level of automaticity. So children who will score high on the naming speed index will demonstrate the ability to rapidly and efficiently retrieve phonological codes from long-term memory. The other one, the symbol translation index, really looks at learning ability, the ability to learn quickly the associations between a visual stimulus and that verbal label for that visual stimulus. So children who do well on symbol translation are demonstrating that they're able to encode the visual verbal association, and they're able to retrieve that newly learned association quickly, immediately in the immediate condition, that is the short-term immediate, and then after a long delay. So if the child doesn't do well on the task, is it because of the encoding demand, or is it because of that retrieval demand? If I don't do well in the long-term condition, is that because I forgot the associations? So again, depending on the data, there might be a number of interpretations associated with a low score on the symbol translation index. And then finally, I think storage and retrieval. Memory really is the way that we know that children are learning. So based on performance on the naming speed index and on the symbol translation index, we are able to generate a storage and retrieval index. And this index will tell you about long-term storage and retrieval, both the accuracy and the fluency of long-term storage and retrieval. So a child who would score high on the storage and retrieval index, and for all of these indices, it's important to keep in mind that if the parts that contribute to the index are disparate, or if there is significant variability, then of course we interpret that overall index score with caution. And I say that because the example I'm going to show you really has a relatively decent storage and retrieval index score, except symbol translation is in the hundreds, and naming speed is lower. So children who do well on storage and retrieval are demonstrating that they're able to learn new information. They're able to learn the association between visual stimuli and phonological codes. So when we think about the cognitive processes that contribute to academic skills, and there are a number of studies that you can access that will describe the cognitive processes that contribute to performance in reading, that contribute to performance in math. We've summarized some of these studies in the WISC-V Technical and Interpretive Manual, but certainly you can access this information in other professional journals as well. So I want to just focus on two areas. I'm going to focus on reading, and I'm going to focus on math. Certainly the information is available for written language as well. So when you think about reading-related processes, the processes that contribute to performance on reading tasks, whether you're thinking about reading decoding or reading comprehension, we as clinicians, whenever we're conducting an assessment that focuses on reading, we always want to make sure we assess phonological processing. Certainly rapid naming is important. Auditory working memory, language is important. I think certainly Virginia Berninger talks about the fact that language by eye, which is reading, builds on language by ear, which is the comprehension of oral language. Certainly executive functions are important. The ability to switch mental set, the inhibition is important, as well as visual-spatial abilities. So some of these, like phonological processing, rapid naming, visual-spatial abilities, they are associated with development of early reading skills. But when you think about reading comprehension, certainly basic language understanding and vocabulary level affect reading comprehension. And then executive functions and working memory certainly are important when you're thinking about effortless reading. We want to make sure that you can see the information and that you can process that information through the phonological loop quickly. Berninger talks about the time-sensitive nature of processing those visual codes that we see. And then the additional skills like visual perceptual processing, fine motor control, we encourage the assessment of those skills as well, because often those are problems that coexist with children with reading difficulties. But some of the cognitive factors that have been demonstrated, that research has demonstrated to be related to reading, certainly include verbal comprehension, working memory, perhaps more specifically verbal working memory, certainly processing speed, rapid automatic naming, certainly consistent with the naming speed literacy subtest on WISC-V, predict reading ability in both younger and older children with a reading disorder. And also we found that children with reading disorders tend to perform poorly on those paired associate learning tasks, such as I described with symbol translation. You can also take a look at our special group studies or clinical studies that we report in the technical manual. We administered the WISC-V to 30 individuals who were classified with a specific learning disability in the area of reading. And certainly when you look at the primary index scores, you'll notice that the clinical mean, the mean for these 30 children compared to the mean of a matched control group, certainly the differences were significant statistically. And if you notice, you'll see that the largest effect sizes were for working memory and for verbal comprehension, certainly at the full-scale IQ level as well. When you look at the ancillary indices, you'll notice that the auditory working memory had the highest effect size, also the cognitive proficiency index, as well as the nonverbal index. And then certainly of all these, notice that your complementary index, that storage and retrieval index, had the absolute highest effect size. So this was one of the lowest scores, 87.4. Working memory was the next lowest score. So certainly the data from this small group confirm that children with a specific learning disability in the area of reading will struggle with auditory working memory, certainly with verbal comprehension, with that paired associate learning. And if you think about paired associate learning, really that's exactly what we're teaching children in kindergarten when we want them to link that symbol to a sound. We want them to establish that association, to pair the symbol this symbol here with the sound or the name S, for example. When you think about math, and I think although the data probably aren't as clear with respect to math, the cognitive processes that are associated with performance on math, certainly I think when you look at the totality of the evidence, when you're looking at the work from David Geary, for example, we know that math disability is common. Probably about 10% of children in our schools have difficulties with math. And what we know is that the processes that contribute to performance in math certainly include attention. Attention is foundational to all learning. Certainly visual-spatial processing. In fact, Geary describes a visual-spatial subtype when he's looking at math disabilities. Working memory is absolutely important when you're thinking about performing math, language comprehension, and executive functions. But again, when you look at some of the research, we find that verbal comprehension, working memory, processing speed, again, if children are struggling with working memory, they're likely to struggle with performance in math. Certainly general cognitive functioning will impact performance in math. Difficulties with attention, semantic retrieval. Again, there is that semantic retrieval, fact retrieval. Semantic retrieval will prevent the child from being able to retrieve basic facts from long-term memory in order to solve math problems quickly. Visual-spatial skills are important. Early number skills, conceptual reasoning are important. Nonverbal reasoning are important as well. So when you think about the cognitive processes, verbal comprehension and working memory are highly associated with performance in both reading and math. And again, when you look at our small clinical study, looking at 28 individuals who were classified with a specific learning disability in the area of math, again, looking at the primary index scores, you'll notice that the clinical mean, the mean for this group compared to the mean of matched controls, certainly the differences were significant for VCI, VSI, FRI, and certainly for VSI, you notice the effect size was one of the largest of all of these. And then certainly the quantitative reasoning index, we'd hypothesize that quantitative reasoning would be a relative weakness for children with math disabilities, therefore would help us to predict math disabilities. 79.9 was the mean of this clinical group compared to 96.2 of the matched control group. And then also the nonverbal index as well as the general ability index. Okay. So I think that this lays the foundation for what I want to focus on now, which is the information that is included in that score report, and hopefully you received a copy of that score report with your handouts. So I want to take a look at this child, and I'm calling him 12, and I think I did that because he is 12 years old. And he is in many ways a typical 12-year-old. He enjoys playing baseball. He likes going camping with his family. He loves to build model rockets. But in the classroom, he is struggling to pass language arts and social studies, and he's having so much difficulty learning new content from his textbooks that his teachers are considering retention. So I want to look at that score report, and I want to focus on the WISC-V because I'd like us to be thinking about how this particular profile or the WISC-V profile would allow us to hypothesize about his performance in his sixth grade classroom, his performance in his functional environment. So why was he referred? In the classroom, he struggles to listen and follow directions. Again, when you think about these referral questions, what are some a priori hypotheses that you might generate or that might even allow you to select certain tests to administer? He struggles to read grade-level text with comprehension. He struggles to meet expectations in writing or in writing responses to show us what he knows. He struggles to complete long-term assignments. Often he's talking when he should be working. So again, you're thinking about all of this information and what this information will tell us about planning an evaluation or an assessment for this child. Now, there are some consistencies between what the teachers are seeing in the classroom and what his parents are seeing at home. At home, he doesn't remember his chores, or he may start his chores, he doesn't complete them. Again, you're thinking, is he maybe missing some of the information that his parents are providing verbally? He complains about assigned reading. He refuses at times to complete written assignments. So we decided to administer the WISC-V, and the report that you have starts out with the basic demographic information that tells you that he was 12 years, 6 months of age when we tested him. So I want to look at the scores, and I want to start by looking at the composite scores first. And I want to start interpretation with the most reliable score, which is the full-scale IQ. Notice that the full-scale IQ for 12 is 103, which is described according to the WISC-V classification system as average. Now, the composite score, the WISC-V, one of the things that we want to look at, we want to try to consider whether or not that full-scale IQ is the best way to describe this child's overall thinking and reasoning abilities. Psychometric G, the ability to engage in complex mental processing. And we know that 7 of the subtests that load on the 5 primary indices yield this full-scale IQ. When we look at the scores at the index level, you'll notice that the scores range from a high of 109 for fluid reasoning to a low of 88 for working memory. So you probably ask yourself if that 21-point difference between the highest and the lowest score is statistically significant and unusual. And we'll look at data to answer that question here in a minute. So I'm not sure that this full-scale IQ is the best way to capture overall thinking and reasoning abilities because of the variability in the scores at the index level. So I'm thinking maybe that the index level scores might be a better way to describe this profile or this pattern of intra-individual strengths and weaknesses, relative strengths and weaknesses, if you will. But to determine if I want to focus on the primary index scores, I want to look first at the subtest scores that make up each of these primary indices. So when you look at this subtest score summary from that report, notice that verbal comprehension, the 2 subtests, the primary subtests, similarities and vocabulary, the scores are relatively consistent, 12 and 11. Also note that we administered the secondary subtests, and those scores are pretty consistent as well. For Visual-Spatial, notice that the 2 scores are pretty consistent, block design and visual puzzles. Fluid reasoning, again, the scores are pretty consistent. Matrix reasoning, 13, figure weights, 10. Notice again that we administered all of the secondary subtests as well. And notice for fluid reasoning that picture concepts is a scale score of 12, whereas arithmetic is a scale score of 6. Keep that in mind if you would please. On working memory, notice that the working memory index is derived from digit span and picture span. Picture span, the scale score is 10. Digit span, the scale score is 6. Also notice on the secondary subtest that loads on working memory, the scale score is 7. Again, you're probably starting to generate some hypotheses about working memory. Is it a working memory deficit, a global deficit in working memory? Or might this be a modality-specific deficit? Again, considering the significant working memory demand for arithmetic, significant auditory working memory demand for arithmetic, similarly significant auditory working memory on digit span, and on letter number sequencing. So again, let's keep that in mind. We'll confirm that later. Looking at processing speed, coding, and symbol search, the scores appear to be relatively consistent. So again, it appears as if 4 of the 5 indices, the scores are relatively consistent. Working memory, we have some questions about whether or not the working memory truly captures 12's working memory, or whether we need to take a closer look at that ancillary index, the auditory working memory index. But before I get to the ancillary indices, I want to evaluate the index level scores to see if there are indeed relative strengths and weaknesses in this cognitive profile. So your primary analysis will allow you to conduct 2 types of analyses. You can compare each index score to a comparison score, and as you know, as your comparison score, you can use either the mean index score, which would be the sum of your 5 index scores divided by 5, or you can use the full scale IQ. Use the mean index score as long as you've administered all 10 primary subtests, which in this case I have. So my comparison score, which is my mean index score, is 103, and you'll notice that the one weakness is working memory, which shouldn't surprise us. We would have hypothesized that. Working memory is a weakness relative to the mean score for all of the indices. Notice it's a statistically significant weakness. The difference is significant statistically. The difference is also significant clinically when you look at the base rate, that frequency of occurrence less than 5%. Okay, so working memory, probably a relative weakness compared to the overall score. You can also conduct primary analysis at the level of pairwise, looking at pairwise differences, comparing one index to another. This information is really instructive because it helps us to determine if we should calculate the general ability index. As you know, the criteria for calculating the general ability index include a significant and unusual discrepancy between verbal comprehension and working memory, or verbal comprehension and PSI, VSI and working memory, VSI and PSI, and so on. We always say you don't need to look at all of these comparisons. We have some a priori hypotheses going into this primary analysis. And my hypotheses have to do with working memory. So I'm going to look at a few of the comparisons that include working memory, comparing working memory to one of those GAI indices, one of those higher order indices, VCI, VSI, and fluid reasoning. So when I look at VCI to working memory, 108 for VCI, 88 for working memory, the difference is 20 points, which exceeds the critical value at the 0.05 level, indicating that that difference is significant statistically. And then I went to the table and found the base rate, and a difference of that magnitude in that direction occurred in only 9% of our overall sample. I decided to use the overall sample as my reference group in this case, as opposed to the ability. That was my other option. Because I chose overall sample because the full-scale IQ is close to 100. You want to use ability level when the full-scale IQ is at the extreme ends of your distribution. Similarly, when you're comparing working memory to VSI, again, significant, depending on your base rate, that would be unusual as well. And then FRI would be same statistically significant, clinically significant. And the reason I said here 14.2, Dr. Sattler talks about a base rate of 15% as being unusual. Other researchers refer to 10%, so depending on what you use. So based on the significant, which is here, and unusual discrepancy between one of these, VCI and WMI, I want to make sure that I calculate the GAI. But you can also look at subtest level strengths and weaknesses, and as you would probably predict, digit span is a weakness relative to the mean of all of your primary subtest scale scores. And again, you could look at the subtest level pairwise difference comparisons. Certainly, matrix reasoning and figure weights, 3-point difference, that difference is significant, not especially unusual. So I'd venture to say still that probably the fluid reasoning index represents a unitary construct. And same thing here, certainly digit span and picture span. I think that difference is significant statistically, and it is unusual. And I think we already captured that when we started thinking about auditory working memory and the working memory index that is multi-component or multimodality, if you will. So I have every reason based on my analyses to generate especially the general ability index. And I probably also want to take a look at the quantitative reasoning index because I know that working memory is really important when you're thinking about quantitative reasoning, when you're thinking about both the arithmetic subtest, and I know I already have a low score on arithmetic, as well as figure weights. Working memory is important when you're thinking about performance on figure weights. But when you look at the general ability index, notice the index score is 109. Cognitive proficiency is 98. But again, when you think about cognitive proficiency, coding, symbol search, digit span and picture span, remember that digit span is so much lower than all of those other scores that really attenuates that score on cognitive proficiency. But certainly look at your auditory working memory index, 81, and that's pretty much based on letter number sequencing as well as digit span. And then quantitative reasoning, the index score is 88. For naming speed, the complementary indices, notice that the index for symbol translation, that visual verbal associative learning, is right in the average range. However, naming speed, the ability to quickly associate or to quickly retrieve from long-term memory the phonological code given a visual stimulus, that score is 78. So again, you want to keep that in mind as you're thinking about what is required to perform effectively in the 6th grade classroom. Now, when you're thinking about whether or not you will actually report the GAI, there is a third criterion. So what I described before, there's a significant and unusual discrepancy between VCI and working memory, for example. That'll tell you that you should compute the GAI, and then whether or not you should actually report it. And even if you're reporting the GAI, please keep in mind that you're always reporting the full-scale IQ in addition to the GAI. But to determine if you'll actually report the GAI, you want to look at this index level pairwise difference comparison, comparing general ability to full scale. If the difference between the two is significant and unusual, then you would want to make sure you report and describe the full-scale IQ, describe why it's attenuated by that relatively lower score on working memory, and then describe why the GAI might be a better way to capture the child's higher order conceptualization and reasoning abilities. Because GAI really looks at those higher order conceptualization and reasoning abilities versus CPI that looks at the efficiency or the cognitive proficiency. How quickly can you get the information into short-term storage that you need in order to solve a math word problem, for example. And then the other comparison that you want to make, and in this example it's probably instructive for us because we're hypothesizing that 12 does not have a global deficit in working memory, but rather that the deficit is localized to the verbal or the auditory modality. So when you look at the difference between those two scores, 7 points, that difference exceeds our critical value, indicating the difference is significant statistically, but a difference of that magnitude in that direction is not especially unusual. The other comparison that you make when you're looking at the ancillary and complementary analysis is comparing naming speed to symbol translation. And certainly the 28-point difference is significant and it's highly unusual. Okay, so I hope a picture is beginning. Sorry, I think this is the same. I had this in here twice. Sorry, so it's going to be in your handout twice. I hope a picture is beginning to emerge about this child, that certainly he is able to learn verbal comprehension, visual-spatial abilities, fluid reasoning, as well as processing speed. But think about the fact that all learning occurs within a working memory environment, and how a weakness in auditory working memory might potentially impact his performance in his classroom. Might that help us to understand why he's struggling with listening and following directions, for example? So what are some hypotheses that you might generate about how he is likely performing in the classroom? The other thing that the WISC-V offers, the WISC-IV did as well, but we've increased the number of process scores on the WISC-V, and certainly process scores are really important because it helps us to think about why a child may have performed a certain way on a specific task. So for example, if you're thinking about digit span, and certainly in this profile, digit span is one of the subtests of focus, you may want to compare 12's performance on the forward condition to his performance on the backward condition. What about his performance on the sequencing condition? Well, his scaled score, his overall scale score, we know was a 7, but his scaled score for the forward condition was 7. The backward condition was 6. Did I say 7 or was it 6? Okay, was 6. And his scale score for the sequencing condition was also 7. So maybe you want to see if the forward condition that requires the encoding, the registration of the information, holding the information in short-term memory, how did he perform given those task demands? And those are the same task demands for the backward and sequencing condition, except in addition, backward would require the child to now transform or mentally manipulate the information. And the sequencing condition requires the child to reorder the numbers in numerical order, so there is also that number value that the child needs to associate with every number that he hears. But you'll notice that performance was pretty consistent on forward, backward, and sequencing conditions. You can actually quantify the child's performance on one condition of a task relative to the child's own performance on a lower level condition of a task. So here, for example, and I pulled this from the technical and interpretive manual, you can derive a contrast score which will tell you about the child's performance on a higher level of a task relative to the child's own performance on a previous level of the task. So let's say the child's performance on the forward condition was a 7, the child's performance on the backward condition was a 6. The contrast scale score is 7. So the contrast scale score is expressed on the same scale as your typical scale score from 1 to 19, and a score of 7 and lower is considered to indicate that performance on the backward condition of digit span is low given performance on the forward condition of digit span. So even though your scale scores are similar, children with similar scale scores on the forward condition tend to have higher scale scores on the backward condition. Certainly, there is some procedural learning that probably impacts performance on subsequent conditions of a task, like backward and sequencing. So the expectation is that the child would score higher on digit span backward and sequencing relative to digit span forward. And then you could also look at the interpretation. If the child's performance on digit span forward is low, scale score of 7, and the contrast scale score is low, then you're thinking about both global attention difficulties as well as difficulties with the mental manipulation, which is required with that backward condition. You can also look at other process analysis scores. Some are expressed as base rates based on raw scores, certainly looking at longest span capacity for the forward condition, backward, and sequencing of digit span, the raw score expressed as a base rate. And any base rate that is 10% or more would tell you that that raw score is atypical. So 12 had 2 errors on naming speed quantity. That is highly unusual. Only less than 2% of children his age in our overall sample actually had as many errors on naming speed quantity. So again, process scores would provide some additional information that's useful for interpretation. And then to think about this now in terms of functional environment. And I think Dr. Wechsler always talked about how the data from a measure of intelligence would help us to understand the child's performance in his or her functional environment. So based on what we know about this child, what would you hypothesize about his academic achievement? And certainly this is what we found. We assessed his performance, his achievement in math, and his scores were within the average range. We assessed his performance in reading and writing. His scores were a little lower. But one of the things I want to point out is that his lowest score, one of his lowest scores, was on pseudoword decoding, and his second lowest score was on spelling. Both of those tasks depend highly on the integration of the orthographic and the phonological. So think about naming speed, where you see something and then you have to say the name that goes with that. Spelling, you hear something and then you have to find the symbols that go with that. So both of those subtests require the integration of the orthographic and the phonological. One begins with the orthographic, spelling begins with the phonological. So again, think about maybe how naming speed will allow us to hypothesize that this child might be struggling with pseudoword decoding and with spelling tasks, that academic areas that have similar demands in terms of performance. So just to integrate the data then, here you have a 6th grade student who is capable of doing well in the classroom. He has average cognitive abilities overall, but he's struggling with listening and following directions. From the WISC-V data, we know that his lowest performance was in the area of working memory. In terms of achievement, his relative strength is certainly math. In terms of relative weaknesses, certainly the auditory working memory is a weakness. Phonological processing is required to perform both reading, decoding, and spelling, and certainly a weakness in phonological processing impacts his performance in both of these academic areas. So when you think about the weaknesses in verbal working memory, paired with weaknesses in phonological processing, certainly this impacts his ability to profit from maybe when you're thinking about teaching reading using the alphabetic principle or using the integration of the orthographic and the phonological. Okay, so I think that pretty much sums up what we wanted to share with you today in terms of how the data from the WISC-V could help us to understand what's going on in the child's functional environment based on what we know about the theoretical relationships between the cognitive processes measured by WISC-V subtests and the cognitive processes that are related to reading, that are related to math, and that are related to writing. We certainly hope that you find this information useful, and we hope that you'll join us in the future on some of our other webinars, certainly on the WISC-V, but on other topics as well. If you have any questions related to the content of the webinar, please do send them to me. My email address is on the last slide in your handout. Thank you so much for joining us, and we hope you enjoy the rest of your day.